Speaking at the maiden biannual health summit of the Association of Nigerian Health Journalists, Anhej, the Minister of Health, Professor Isaac Adewole, expressed worry on the theme of the summit tagged Persistent Poor Health Implementation of Health Budget. He stressed that the problem of health sector budget has not been in the result of poor implementation, but of inadequate allocation and poor release, while assuring that the President Muhammadu Buhari's administration has shown greater commitment to the release of budget funds against what was obtained in the past. He noted that the poor health indicators such as maternal mortality, malaria, HIV and AIDS, and tuberculosis, among others, will be improved on.
It should not be persistent poor implementation, but that I should look into how the media and us in the health sector can work together. So I actually changed the title to Health Budget Implementation, the media as advocates. And to me, we will still achieve the same, because I know your concerns. One is that the health sector is not getting what it ought to get. In spite of the challenges, in spite of the recession, we have shown more diligence, more discipline in releasing money. In 2016, federal government released 100% the total polio allocation.
Professor Adewole advocates for greater investment in health while tasking the media to make health matters a headline issue.
We need to change the narrative. We need to really project health, not as an item of expenditure, but as an indicator for success, an essential ingredient for socioeconomic development. And this is important. We need to be able to say, look, when we invest $1 in infrastructure, the return is $3. When you invest $1 in immunization, the return is $16. When you invest $1 in the TB program, the return is $85. So you now ask yourself, which one pays more? Infrastructure or health? The answer is health. So working with you, we need to change this narrative to say, how can we convince people out there that we must invest in health?
The Commissioner for Health, Niger State, Dr. Mustapha Jibrin, the Chairman, Community Health and Research Initiative, Dr. Aminu Magashi, and the representative of the Executive Director, National Primary Healthcare Development Agency, Dr. Eugene Ivase, lend their voices to the poor implementation of health budget.
If one media writes something today, there is chances that many political actors will not see. But if 20 media houses write one issue today from different perspectives, then the political actors will feel the pressure to deliver the mandate.
All like-minded stakeholders in the health sector, including the media, and particularly Anhej, need to come to the point of pushing the advocacy agenda to the executive and the legislative arm of government for implementation of the Health Act.
It's one thing to allocate 15%, 10%, even 5% or 2% to the health sector. There is also the problem of budget implementation, getting relief, getting those funds released in order for us to implement all that we need to implement in terms of the healthcare service delivery.
The event marks the inaugural maiden biannual health summit of Anhej, high point of the event for the unveiling of the association's logo by the Minister of Health. Joseph Kadri, ITV News, Abuja.